Hi, I'm Mel Pruitt. I'm the General Manager of Family and Community Services here at BRAMS, or Bream Regional Aboriginal Medical Services. Here at BRAMS, we're an Aboriginal medical service. We deliver primary healthcare services through our clinic, and this makes up half of our organisation. The other half consists of various programs, all falling under family and community services. The programs offered include aged care, disability, social and emotional wellbeing, family and domestic violence, and psychosocial services. BRAMS follows a holistic person-centred approach where individuals accessing the clinic can also access programs offered by BRAMS such as NDIS or aged care.
So when we first started our services as a registered provider, we had a look at what we wanted to achieve in terms of our service delivery, and we started off with support coordination. So that was essentially the area we focused on building up, and that's the coordination of supports for people with plans. So looking at understanding their plan, what the funding is in there, what the plan goals are, and then how to get the best service and giving choice and control back to the participant, the person, to design and I guess understand what would be the best fit for them.
Because back in the day when it was like when I was very younger, like before this, like before I did art and before I did all of this stuff, I could never read, I could never write. I'll never even know how to tie my own shoes,
Initially, BRAMS faced challenges with the overwhelming number of clients and limited staff. However, we addressed these issues by onboarding some additional staff and reviewing the processes.
Yeah, my name is Vincent. I work at BRAMS, an NDIS support worker. I think it's important for a lot of people like Sam, who has trouble, expressing themselves, just to help them out in any way possible. It could be small things like just listening to their stories if they're feeling upset, they're angry and stuff. It's just someone they can either vent to or, so they know it's always going to be confidential with us, and we're not here to judge.
No, it actually feels pretty good for someone to understand you and to relate to you sometimes in that case. It just feels better than someone not responding to you or anything. Yeah.
It's a big program, Commonwealth program, NDIS. So it's about explaining how, in a simple, easy to understand way, how to navigate the system, because it is quite complex. There are so many different areas, things to be mindful of, things you can get support with, and the criteria and those sorts of things. So being able to understand that and then explain it and make it easier for our participants to understand has been, one of the challenges. So yeah, we're getting better at that. So yeah, being able to just break it down and assist people with the things that they actually need, and also not just telling them what they need, but asking and getting there. It's person-centred, so it's what do they want, what are their needs, helping them identify what they want and then choose good supports and services.
One of the main challenges for us was integrating NDIS services into an existing primary healthcare setting. It required adjusting policies, key documents, our record keeping, asset management, and other aspects to accommodate the NDIS services within the BRAMS framework. The key takeaway is that the process of improving service delivery and billing is not straightforward, requiring constant review, upskilling, and attention to detail. In the beginning, we took on all NDIS clients. However, shortly after that decided to have a primary focus on serving our Aboriginal and Torres Strait Island clients. This decision led us to concentrate on our primary cohort, prioritising the health and well-being of Aboriginal people.
I like coming to art groups and stuff, groups like this, because you have help from everyone. Like the workers, you make new friends, you know, like you see all different faces. Yeah, it's good. I like making new friends and everything.
When a new client seeks services at BRAMS, they go through an intake process. The intake team assesses their needs and refers them to relevant departments. Once approved for services, the client meets with the team leader to discuss their needs, preferences and goals.
Yeah, well, like BRAMS helped me through getting through NDIS, more like to get to do fundings and everything like that there. So, you know, if it wasn't for BRAMS, I wouldn't have known for NDIS more at all.
The focus of BRAMS is now on expanding our aged care services now that we've reached the end of our pilot phase for transition care into our fee-for-service home care packages.
So stay at the hospital, it's a quite hard period for the participant, and TCP will be just helping the person to just improve their health and get back to the way that they were before they come to the hospital.
After the hospital, having that aftercare help, checking in on them, seeing if they need anything, transporting them, up and down to BRAMS.
Regarding the NDIS, BRAMS plans to continue our current services with anticipated expansion in the domains of core supports. BRAMS takes a non-mainstream approach to this service delivery, emphasising cultural safety, and currently 3 out of our 4 support workers are Aboriginal people.
NDIS is a great help. Like, it will get you places, like places you never been before, like how you are now. It's different. Your life's gonna be different when you get connected.
We are also currently building our allied health team, including our occupational therapists, physiotherapists and speech therapists, and when completed, this team will be able to provide services across both aged care and disability. So, although our journey as an NDIS registered service provider has been challenging at times, we're looking forward to the future of expanding our service delivery and continuing to deliver that culturally safe care to our Aboriginal people in Broome.